This chapter is on wounds. So when we look at wounds, what we're talking about is a break in the skin surface, and this ends up resulting in an external bleed. Now, the issue with this is, again, your body's first line of defense is your skin. Now, once that's been breached, now you're allowing for pathogens such as bacteria or a virus to enter rather easily. And this ends up in an infection. So this is why it's important not to breach the skin. Now, what are some of the different type of wounds that you can have, or types of open wounds? So the first type that we see over here is an abrasion. So in an abrasion, just the epidermis is involved. So it's epidermis only. And again, this is a superficial wound. The top layer of the skin is removed. There's little or no blood loss for this. However, at the same time, even though there isn't any blood loss, it is painful. So, you can't dismiss these as being mild of any sort. Again, this also serves as, there's a high risk of infection when you have an abrasion. Why? Because again, top layer of skin's been removed. So we have to address that. Other types of wound are what we see over here. This is a laceration. So when you look at a laceration, you're looking at a cut with jagged edges, right? So they're not nice and clean, they're not even. You can see how this part, it kind of looks like that. It's squiggly. So this is a jagged wound. And again, this is when these edges, they're irregular. So, and the term that we use to describe that is a laceration. When you compare that to an incision, the edges are smooth. So an incision, a good way to think about that is, anytime a doctor cuts you open, you'd call that an incision. If you end up getting hurt by yourself, you probably have a laceration. That's how it's going to be described. Moving on, other types of open wounds that you can have, that one could have, is a puncture wound. Now, a puncture wound, they tend to be deep and narrow. There may be bleeding or there may not be bleeding that's present. You might see, for example, if you look over here carefully, there's like maybe a small drop of blood that's present. But aside from that, there's not much, and probably on the other side, there might be another drop of blood over there. So a puncture wound, again, it's deep and narrow, and there's a high risk of an infection for puncture wounds, especially if this nail has been contaminated or whatever object that's penetrating the body or the limb. You're opening yourself up to infection. The next thing we have is an avulsion. So an avulsion is when you have tissue that's just been ripped off, that's been torn off. So, when you have a flap of skin that's torn and it's loose, we call that an avulsion. The next one is what we call an amputation. And an amputation, this is when you have either, a cutting or tearing of a body part, okay? So cutting or tearing of a body part. This is what an avulsion is, an amputation is. Body part, there you go. Cutting or tearing of body part would be an amputation. So what do you do? How are you supposed to cure for open wounds? First of all, again, the most important thing to do is before you go and help somebody else, you have to help yourself. And in doing this, universal precautions. Okay? So what is universal? What are universal precautions? At the very least, what could you do? What should you be doing is wear exam gloves. Okay, that's the easiest thing that you can do. Put on exam gloves. The other thing, especially with what's going on these days, with airborne particles that maybe some people may have viral airborne particles such as this COVID-19, somebody coughs, or again, there's blood and it comes into contact with your mucous membrane, you're at a higher risk of infection. And it's not just COVID-19, but again, it could be the human immunodeficiency virus, okay, as well, that may be transmitted by blood. If that person, if your patient is HIV positive, there's blood that spurts out, or again, that you come into contact with, and you yourself have a break in your skin, then, you know, you're increasing your chance of contracting that virus. So again, you want to limit your exposure. So once you've got your gloves on, if you have a face mask, you put on a surgical mask or protective gear for your eyes. The next thing you want to do is you want to expose. In other words, again, where is the bleeding coming from? Sometimes you may need to cut a shirt, or you may need to cut one of the sleeves of their jeans that they're wearing, so you're able to access the area of injury and properly assess the bleeding, the trauma to that area. Lastly, again, what you want to do is you want to control the bleeding by applying direct pressure. Now, so what can you do? One of the things that you can do is, first of all, you know, hopefully before you put on your gloves, again, make sure your hands are clean, so wash your hands with soap and water. Now, as far as once you get to the patient, you want to clean the wound. Again, for shallow wounds, you know, you can wash it with soap and water. If you have a sterile water available to you, you can use sterile water as well. So again, let's put this on. You know, you can wash with soap and water. Or again, you can also use sterile water if that's available, or a saline solution. That could be also. Or again, you know, if you have access to a syringe, so sometimes, you know, you can use a syringe, you can fill it with some sterile water, and then you can just kind of, again, squirt that into the wound under pressure to remove any debris that may be, or any other pathogens that may be present, just to wash it away. So that's something else that you can do. You know, you can flush it with clean or sterile water, okay, under pressure with the syringe. Okay, so this is another option that you may have. So once you've done that, now what else are things that you can do? So again, remember, what we're trying to do is we're trying to limit the exposure to pathogens, anything that can cause disease. So bacteria, virus, fungus, yeast for that matter. This is what we're trying to reduce. So, you know, once you clean out the wound, once the wound's cleaned out, then, you know, if need be, you want to have that patient sent to a doctor possibly, if they need hospitalization, or again, if you feel that that patient may need stitches, for example, and we'll talk about that hopefully later on in the lecture. If stitches are needed or sutures are needed, then again, they have to go to an emergency room, or perhaps they're in an urgent care center, or their own personal doctor may be able to do that. If you see any embedded debris that's within the wound, and you have access to tweezers, so you can use tweezers to remove that embedded debris. Okay, so this is something that you want to look at. Again, when you're applying direct pressure, right, the bleeding should stop anywhere from 5 to 10 minutes. Bleeding should stop. If the bleeding does restart again, then you want to reapply direct pressure onto the wound and hold it there until it stops. Again, you want to hold it on for another 5 minutes, perhaps 10 minutes, and once the bleeding stops, then you can release that pressure. So again, if bleeding restarts, what do? You always apply pressure. Okay, so this is important. Apply pressure. Now, covering a wound. So when we're talking about a dressing, all right, so dressings end up getting applied over a wound to control bleeding and also to prevent infection. You don't want any contamination. But when you're putting on a dressing, make sure what you're using is as clean as possible. All right. If you have access to a dressing that's sterile, that's perfect. If not, then make sure it's clean. Sometimes you don't have that option. You may not have a dressing with you, and or sometimes it may not be a sterile dressing. So whatever you're going to be covering on top of an open wound, you want to make sure that at the very least it's clean. The other thing that you need is a bandage. So the purpose of a bandage is to hold the dressing in place. Now a bandage, it does not need to be sterile. So this doesn't need to be sterile because it's not going to be covering the wound. It does not need to be sterile. However, a dressing, preferably it should be sterile, and at the very least it should be clean. All right, because this is the dressing is going to be applied directly on top of the wound. So if you have a wound which is small, then what you could also do is you can apply, a thin layer of antibiotic ointment or an antibiotic cream. So a thin layer of antibiotic ointment or a cream, antibiotic cream. Both of them, either or, will work. So once you have this antibiotic ointment that's on, then next thing you do is you want to take that, you want to cover it with a dressing. Now remember, hopefully this dressing is sterile. Okay, that's what you want. If not, then make sure that it is clean. But it should be sterile. Always try to use something that's sterile. Why? Again, you have an open wound. So you don't want to introduce, a dressing that is contaminated with the bacteria. And now that bacteria, you have an open wound, it's just going to go inside and start growing over there. The other thing is, don't pull off a dressing that's become stuck. Okay? If you have to remove it, then what you do is you want to soak it in water and let it loosen up, and then you can gently pull it off. So you never, you never directly pull off a dressing that's been stuck. What do? Soak it in water. Okay, soak in water. And then gently, you want to pull back on it. Gently pull back very slowly, and then it will come. Because if you just yank it off, you pull it off really fast, the bleeding is going to start again. You're going to break away the clot. You're going to pull the clot that's developed off, because that's what's happening. The band-aid, the dressings got stuck to the clot, and it's not able to come off. So when you're pulling on it, what you're doing is you're going to end up unplugging that damaged blood vessel. So when you soak it with water, essentially you're kind of breaking away some of the clot between the blood and the dressing. And if you're able to control, do it very gently. Once you kind of get it wet and you break up some of that clot, that blood that's stuck to the bandage, then what's going to happen is you're not going to pull off you're not going to break that entire clot off. And again, this is when you maintain hemostasis at that point. Now, if the dressing is wet, okay, or it becomes dirty, or that dressing becomes soaked, now you have to change it again. So whenever it gets wet, it becomes soaked in blood, then you have to change it. Okay, then you can remove it. So now, what about high-risk wounds? So first of all, as far as high-risk wounds go, let's just kind of talk about what some of these are. So anytime you have something that's embedded within your a limb or a body part, it's high risk. So again, that could be a nail, it could be, a branch from a tree, or it could be any object, anything that gets stuck in you. That's, it's high risk. Why? Because again, it's penetrating your body, and whatever pathogen is on there, now that's, there's a possibility that it's going to enter your bloodstream. And you can end up getting systemic infection. When animals bite or actually not even just animals, but even human bites. So both animal and human bites. These are also high risk. Why? Again, there is a reason for transmission of pathogens. And again, humans, if you think about it, someone has an open wound in their mouth, there might be a little bit of blood, and they come out and they bite somebody else, and if that person is HIV positive, now there's a risk, there's a chance that that person that they've bitten, the blood got in, some virus particles were able to enter, then at that point that person would be infected with that HIV virus. And then in the case of animals, again, it could be rabies if you're talking about a cat or a dog for that matter, or even with rodents these days. Or actually, so moving on, what else do we have? Penetrating wounds. So again, when something is embedded, it's also it's penetrating. So these both these they go together. Again, these will be deep wounds, penetrating wounds. Again, they're deep. They tend to be large, and again, it's risky because of the risk of transmission of pathogens. Also, again, because it's going deep in your body, blood vessels could be severed. Right? Forget the neurological damage that results from it. Let's put that aside. But again, severing a nerve is not going to kill you. It may not kill you. But definitely, if a major blood vessel has been damaged, that will kill you within minutes. So when we're looking at complex wounds, for complex wounds, we're talking about again, when more or less same thing in complex wounds, you could have deep tissue injury. In addition to that, it might be a combination of, for example, an avulsion and a penetrating injury, or an avulsion and, someone that's bitten you as well. So again, you have multiple injuries, multiple type trauma that's been resulted, that you've been afflicted with. So moving forward, what are some of the tissues that you might see? Well, you could see, sometimes you might be able to see bone. Other times you might be able to see, you might even be able to see a cavity, a body cavity that may be present. Or again, you might be able to see a joint capsule. So these are some of the times, some of the visible tissues that you may be exposed to, you may see when you're trying to help somebody. So now, when does a wound need sutures? First of all, another name for sutures, stitches. Okay, these are interchangeable terms. Stitches and sutures, they're the same thing. And these are best when, they're placed anywhere from within 6 to 8 hours after injury. All right? So this is when you need to have, this is the time frame to have stitches done. More than 12 hours, or actually more than 24 hours, depending on who the physician is that you go to, they're not going to do it. They probably won't get it done because you already have healing, that's secondary healing that's taking place, and it's a little bit too late for that. So ideally, you want to get this done within 6 to 8 hours, definitely under less than a day. Now, one of the things, again, you end up getting, anytime you end up having an open wound, again, risk of infection, especially if you have penetrating injuries, you want to make sure that you're updated on your tetanus vaccines. If not, at that point, they're probably going to end up giving you a tetanus shot. So, as long as you have it within past 10 years, you've been vaccinated for tetanus, you're okay. Now, if it's a dirty wound, so usually 10 years this vaccine lasts. Now, let's just say you end up getting injured and it's a very dirty nail or dirty piece of glass, for that matter, that's caused injury. At that point, if it's been more than 5 years, they'll probably give you a booster at that point. Right? So, on 10 years, you're relatively safe. But if you have a dirty injury, then 5 years. What are some of the things that raise risk of infection. Well, again, if you have a wound with, you know, some type of a foreign material, a foreign object that's been embedded in you, now your risks are much, much higher. Again, you end up having some type of debris, especially if it's contaminated or dirty debris within the wound. That's going to increase your risk of an infection. If you have rugged or crushed tissue injuries, that also raises infection, your chance of infection. The other thing that you have to think about are what's underlying beneath the injured areas. Okay, what's there? Now, is there injury to nerves? Okay, so nerve damage. What about tendons or joints? These are some of the things that you kind of keep in mind, right? In terms of when there are these open wounds, about the underlying tissue that's present, what's going on over there. Now, when it comes to bites, of course, again, you end up having a bite wound. That's, you know, you're looking at higher risk of infection whenever somebody bites you. And I kind of gave you the example earlier on about, you know, if the person that's biting, for example, somebody decides to bite someone else and they're HIV. Now they have a wound in their mouth or in their saliva, there is an HIV particle. And once they bite their victim, there is a chance that that HIV virus now has entered the victim. So again, this is one of the dangers of bites. And again, bites, you know, they could be puncture wounds as well. So now you're penetrating, poking a part of the body. They could turn into avulsions. Anytime your hands and feet are involved, okay, so this is also, now you're raising your risk of infection. Why? Because you're walking on your feet. Maybe you're not wearing shoes, or maybe you have sandals on, or maybe you have slippers on, or perhaps the shoes that you're wearing, they're contaminated as well. So again, if you have a wound in your feet, and again, the ground, generally speaking, there are lots and lots of germs on the ground. And again, higher risk of infection. Same thing with your hands. Again, you touch everything. All the surfaces on your desk, your computers. You go into public areas such as the subway, the metro, or the metro bus. Everybody's coughing, sneezing, picking their nose, God knows what. You don't know what's going on. You don't know where somebody has placed their hands. Somebody comes out of the toilet. They don't clean, if they've or a fecal route, right? For example, so someone touches their, they go to the bathroom, they wash up, and they don't wash their hands properly. They clean themselves, and they don't wash their hands properly. Now they go out and they start touching everything. Well, if there's any type of for example, a bacteria or a virus that's present, and especially if it's virulent, very highly virulent, if it's very contagious, it spreads easily, then they can infect quite a few people. So again, just by people not touching and cleaning their hands properly, they can start to spread pathogens. So again, this is where when you have open wounds to the hands, you're at high risk. You need to kind of cover it. Why? Again, I just gave you the example. We touch everything with our hands. And then also, again, I told you before, puncture wounds. Again, wounds that are not able to drain. If bacteria starts to build up and up and up, then you're raising the risk of infection. Also, puncture wounds, as I said before, you end up introducing foreign materials into the body with whatever is impaled within you or whatever has penetrated that body part. You raise your risk. So when you look over here, what are we seeing? So first of all, we're seeing a lot of swelling and redness that's around this wound. Also, if you touch it, what you're going to feel is that it's probably warm, and this is a sign of an infection. Also, it's painful, okay? You're going to feel a throbbing pain when it comes to this. In addition to that, there's going to be fluid, probably fluid or some type of pus that's being discharged, and you can see that over here. There's some discharge of pus from there. You can see the erythema that's over here. Also, you can see general edema and inflammation around the margins over of the wound. So aside from that, what else will you see? You'll see the patient may have fever, or they'll have swelling of the lymph nodes. And a lot of times also you can see red streaks leading from the wound that could travel towards the direction of the heart. So that could also be present. What do you do when somebody's, when you have a wound that's infected? Well, again, if it's something that's mild, if it's like an abrasion for that matter, it's not deep, and again, especially if there's not any pus coming out. First of all, if it's infected, you definitely want to get them to the doctor. But, again, until that time, in the interim, until that patient is able to go seek professional care, what you want to do is, again, you want to soak that wound in warm water. Okay, soak the wound in warm water, or also you can apply a warm compress or wet packs over that infected wound. The other thing is you can apply some antibiotic ointments. That will help rather well. Again, you have to change dressing several times a day, maybe 3-4 times a day, at least 3 times a day. You want to change the dressing. So again, change the dressing, apply more ointment, put another dressing on every 6 hours. It's probably best to do that. And again, when you get an infection and wounds are painful, so perhaps an NSAID, they might need non-steroidal anti-inflammatory drug, or they may need an opioid, or again a narcotic to control their pain. So again, you want to manage pain, whether you don't want to discount someone's level of discomfort. Again, always monitor, keep monitoring, make sure the infection is not spreading, it's not getting worse. And again, if you do think that it's getting worse, you start to see more swelling, then they definitely need to go to an infection control specialist. Again, if they went to the normal doctor and it's still getting worse, then they might need to go see somebody else, a specialist for that matter, perhaps a dermatologist. So again, they have to seek medical care if that infection gets worse or if it persists. And perhaps at that point they may need to take some systemic antibiotics. So when you look at talking about tetanus is caused by a toxin-producing bacterium. Okay, so this is what tetanus is. It's a toxin-producing bacteria. All right, and again, this guy likes to travel to the nervous system, and then it causes your muscles to contract. Okay, this is what we end up calling lockjaw. There's no known antidote for it, to this toxin, but they do have a vaccine and boosters that people can get to prevent from getting this disease. So that's the good news about tetanus. So if you've never been immunized, you need to get this vaccine, or again, if it's more than 10 years, you need to get a booster. You come into dirty, contaminated wound, and if you haven't had a booster in 5 years, you need to go and do it. So remember, I told you earlier on, as long as you have if you've been vaccinated within 10 years, you're good to go. But you end up with a wound, and it's been if it's been more than 5 years, at that point, you need to get a booster. That's for dirty wounds, okay? And again, you have to get this within a 72-hour time frame. So you end up, for example, I end up getting punctured by a nail today. I'm walking home, I step on a nail, and now it's penetrated my shoe and punctured and come into to the sole of my foot. Well, I've got this time period, this 72 hours to go and get a booster if I haven't been vaccinated in the last 5 years. Again, this assumption is that it's a dirty nail. So when you're talking about amputations and avulsions, again, we're talking about tissue being torn away, or again, cut off, tissue that's being cut off you. Now, in many cases, an amputated extremity, it can be successfully reattached. Now, avulsions, most often, we're talking about, avulsions will involve the ear, fingers, and hands, and these can bleed rather heavily. So again, you want to do your best in controlling the bleeding for both of these. So if you look over here, essentially what we have is that, again, it's a clean amputation. Why is it clean? Because, again, it's a nice clean slice. It's not jagged or anything. It looks like an incision. So this looks like a thumb that's been amputated from this person's hand. So it's a nice, clean, complete cut. Other types of amputations could be when there's a crushing injury. So this is when, I don't know if it's a finger again, for example, it's either, again, it's been crushed or it's been mashed off. Other types of amputation is when you have what we call a degloving. And in degloving injuries, or in a degloving amputation, this is when the skin is actually, so again, the skin is it's peeled off. Just kind of like how you take your gloves off your hands. The skin will come off as well, just the same way. Okay, so that's what we called a degloving type of amputation. So what do you do when there's an amputation? First of all, pick up that phone, call 112. You want to treat that patient for shock and control the bleeding as best as you can. The next thing you want to do is you want to care for the body part that's been cut off. So what do? Again, first of all, make sure you have your gloves on. Wrap that body part in a wet, sterile gauze or a clean cloth. Okay? Make sure it's wet. The next thing you do is you want to put it in a waterproof container of ice. Okay? Waterproof container of ice. Then as soon as, again, when you call 112, the ambulance comes, send that body part with them. Because again, as we said earlier, most of the time, body parts are able to be reattached. So, what about for an avulsion? Now, as far as an avulsion goes, gently move the skin back into its normal position. Again, make sure you're wearing gloves. After you're wearing gloves, make sure your hands are clean. Gently move the skin back into position. Okay, that's what you want to do. Make sure it's done. This is the key word over here, gently. Then cover it with a sterile or clean dressing and apply pressure. Again, you don't want to introduce any more pathogens and you want to control the blood loss. If it continues to bleed, at that point you want to apply a tourniquet or some type of a hemostatic dressing if it's available. Okay. So let's put that down. If the bleeding continues, what do you want to put down? Tourniquet. Or hemostatic dressing. What do we see here? A blister. So what's a blister? A blister is just a collection of fluid in a bubble under the outer layer of the skin. So this is just fluid that's collecting under your epidermis. And it's caused by repeated rubbing of the skin. Okay, so it's a repetitive injury. It's treatable and it's also rather preventive. Sometimes these things can happen. On your in the back of your heel, in the back. If you're wearing shoes that are too loose, and every time you walk, the back of your foot, it rubs against the shoe. You end up getting these blisters. Or other time you're wearing sandals and they're too tight and there's some rubbing going on. That will do the same thing. It will end up resulting in a blister. So again, they're easily treatable and they're rather preventable. So what do you do for a blister? Relieve the pressure. How do you relieve the pressure? Put on a blister bandage. You can try surgical tape or even elastic tape. So for a blister that's closed and it's not very painful, you can you can use any one of these things that I told about before. You know, you can just apply a band-aid. That would be good enough also, right, to end up treating that. Again, take a tape, trim the round edges of the tape, and you just kind of cover that up. That will help with that blister as well. So, you know, if it doesn't end up getting worse, it won't be as painful. Now, for a blister that's closed and is very painful, what can you do? So, first of all, universal precautions: put on your gloves, put on a face mask. If you have goggles, put those goggles on. So the first thing you do is take some alcohol and take a clean or sterile gauze pad and clean that area. So clean the area with some alcohol, isopropyl alcohol, hopefully at least 70%. The next thing you do, you take a sterile needle, okay, and you puncture it. You put, I don't know, 5, 6 small holes there, and you puncture it. Okay, that's all you have to do. Next thing is you could apply some paper tape, cover it with an elastic or an adhesive tape. You can just trim around it to give it nice round edges, and you know, just monitor for signs of infections. Make sure it's not getting infected. So as long as you're doing that, you know, that should be sufficient. So again, for a blister that's very painful, it's open or it's torn off. So for that, you know, what should you do? You know, you could trim off the dead skin. Okay, that's one thing you can do. Trim off the dead skin. You could place a blister pad over the raw skin, right? You can cover it with the adhesive tape. And again, always watch for signs of infection. So when you look at this photograph here, what do we have? We've got what looks like, I don't know what this is. It's some type of a metal object that's, you know, it's impaled, it's embedded within this person's thoracic cavity. So now embedded objects, they should be stabilized. Okay, so again, this is the important part. Make sure this is stabilized. So embedded objects is very important. Stabilization is very important. Again, this is done to prevent internal injuries. It's for the prevention of internal injuries. All right, what more? What next? Let's go back, sorry. All right, so a splinter. All right, now they're talking about you have a small sliver or a splinter. What do you do? So again, you know, splinters, it could be a small piece of a wood that comes into, you know, that may go inside your finger or your skin. So these are very small things. So again, if you have tweezers, you can just remove it with a tweezer. That's one thing to do. Wash the area with soap and water. You can apply some antibiotic ointments over here. So you can put down antibiotic ointments. All right, you can put that down. And again, clean it with soap and water. And you know, what do you do afterwards? You remove it with tweezers. I'm sorry, let's go from the top again. Remove it with tweezers. Wash it with soap and water, apply antibiotic ointment, and then lastly, just cover it. Okay? Cover it with some sterile gauze or a sterile dressing, banded, an adhesive bandage. When you look at large impaled objects, okay, large impaled objects. So again, as we said earlier, you want to stabilize that body part, okay? So this is very important. Stabilize the body part, and also you want to stabilize that object Why? Because you want it to move around and causing more internal damage. So stabilize that object. Next thing, if it's bleeding, apply direct pressure around the base of the object. Okay? If there's any bleeding around the base of the object, that's where you want to apply direct pressure. Now, sometimes again, if you need to transport that person, okay, and again, there's something very large they're embedded with, maybe a very long branch. Now, there is no way for you to place that person inside of a car if they have this object in them. So it may be necessary to cut off part of that tree branch or whatever that object may be. Or again, sometimes it may be necessary so it doesn't go in further deeper into the wound. So that, you may need to do something like that. And of course, and again, you need to call 112 or, your EMS system. All right. You have something that's stuck inside of you. All right. Maybe it's a screwdriver, maybe it's a knife, maybe it's something else. And you're more than an hour away from a hospital. What do? So, perhaps you need to remove that object. So how do you remove an object? How do you remove something that's impaled? And again, in this case, we're talking about the cheek, right? This happens. So you want to take 2 fingers, okay? 2 fingers next to the object. Okay, so 2 fingers next to the object. Gently pull it in the direction from which it entered. Okay, the same direction that object entered is the direction you want to pull it out. Okay, so pull that object the same direction that it entered. All right, and it should come out relatively easy. Now, what if you're not able to remove it easily? What if it can't be removed easily? If that's the case, then leave it in place. Right? Don't mess around with it. Leave it in place. Just secure it. Secure it with the bulky dressing. And then once they get to the emergency room or the advanced medical services, at that point they'll be able to better deal with it. So now, as far as bleeding goes, okay, and controlling the bleeding, after you remove the object, okay, so once an object's been removed, you want to place the dressing over the wound and inside the mouth. So remember, what were we talking about? Okay, we're talking about it, cheek. So place the dressing over the wound inside the mouth, and also you want to place the dressing over and outside of the wound. So both inside and outside, you end up having dressing. Now, what if the eyes are involved? Okay, you've got something impaled in the eye. What do? So do not exert pressure on the eyeball. Okay, you don't want to put more pressure over there. Stabilize the object, whatever that's there. Okay, if it's long, use a bulky dressing and place a paper cup or a cone over the eye. If it's short, you want to surround the eye with a ring pad held in place with a roller bandage. Okay, so for short objects, a ring pad secured with a roller bandage, that should be good enough. Aside from that, you also want to, a lot of people forget this, you also want to cover the undamaged. Okay, you also want to cover the undamaged eye. And then of course, last but not least, you want to activate EMS, pick up the phone, call 112, whatever your number is, your emergency number is to call, 911 perhaps. What if you have a cactus spine that's stuck stuck inside you? How do you remove that? Well, again, relatively easy. if you have tweezers, pull in the same direction that it entered. All right, you can do that. You can also use glue or rubber cement. You apply a thin layer, you allow it to dry, and then you just end up rolling up that dried glue, and then it'll come out with it. So that's another easy thing to do. And then sometimes, you can also use a combination of both of these things. You use glue and rubber, and then you use the tweezers to pull it out. Sometimes, you can use a cell phone tape or some type of an adhesive. Put it on top and just pull the tape out, and whatever's stuck will also come out along with it. So it's relatively easy. It's not very difficult. Now, fish hooks. Okay, so this could happen sometimes. You're taking a walk, and someone's fishing. They pull back on their fishing rod and to cast, and unfortunately, it comes into you or a child or somebody else, or maybe just get stuck in themselves. So you want to tape that fish hook in place. Why? Because you don't want it dangling around. You don't want it to move around anymore and, again, cause more damage. If the barb hasn't penetrated the skin, then, that's some good, I guess you can consider it to be, that's a good part. It's a good thing. So what's a barb? So this part, the sharp part, so there's two sharp parts. There's one sharp part here, and there's another one over here. So this is what we're talking about, this second part over here. If this hasn't penetrated the skin, all right. Now, you can pull it back pretty easily, okay? If you just gently pull back out of it, you back up, then this part will come out. All right, the fish hook will come out pretty easily. Again, you want to treat this as a puncture wound. And of course, you always want to make sure if that person hasn't had a tetanus vaccine, make sure they end up going and getting vaccinated for that. Right? So tetanus is something that you should keep in mind. So again, you want to treat the same as you would for a puncture wound. Now, what if the barb has entered the skin? Okay, it's gone in pretty deeper. So again, they need to go to a doctor. All right. Now, if you can't go to a doctor, then you could remove the hook with some pliers, or what's also called a string jerk method. So there's a couple of ways to end up to remove this if that barb has gotten inside as well. So again, if you have pliers, you could just kind of cut this part off, and then you can apply some counter pressure to it, and then it'll end up coming out. Now, sometimes what ends up happening is this part may actually go all the way through, so this entire part is coming out. So if that's the case, if this entire part it is coming out the other side of the skin, at that point you can just cut over here, and then once you cut it over here, because the barb is going to be upwards, you can cut this with some steel pliers, and then you pull out the other side, the other way, the direction that this hook is going. You can pull it out that way. You don't want to pass this thing back through. So if you look over here, now this string method, also actually perfect, they're telling you what to do. So if you look over here, what you could do is, so the barb is over here, you can see right over there. That's where the barb is. So if you cut it over here, now what you could do is this part falls off once you cut that, and you can just pull back over here, and it's off, right? So aside from doing that, you want to apply an ice pack or just put on some pressure. The next thing is, so again, that's going to help. Once you cut this off, just kind of push, or sometimes, if it's not, as you can see over here, this is almost about to penetrate the skin. It hasn't completely penetrated. So if you push through a little bit more, if you kind of push up, again, you want to kind of go into that direction of this hook. So again, what are you doing? You're bringing this upwards. So again, you bring this up so this comes out nicely. It comes out. So this is what they're talking about over here. Push it up a little further until it's able to break through. And then you can start cutting off and pulling out the other way. You pull down, because remember you kind of pushed up over here, now you're going to pull down, and this part fell off already. The string jerk method, essentially what ends up happening with this method is, again, what you're trying to do is you're disengaging that barb. So essentially, first of all, you want to get this part nice and straight, okay? And then you secure it with a string. On one string, you kind of loop it around. You make two bands coming out. One string over here, another one over here on this side. Make sure it's nice and taut. Once it's nice and taut, and this is straight, you want to give it you want to pull firmly on it, so you get a one strong tug, and this thing will come out. Okay, it'll disengage. For closed wounds, okay, so closed wounds, it could be caused by some type of a strike with a blunt object. Okay, a blunt object comes and hits you. Now, with closed wounds, again, remember, you're not bleeding outside, but that, you could be bleeding inside, so there could be internal bleeding in closed wounds. So the skin isn't broken, but tissue and blood vessels, there's a good possibility that they're damaged, they're ruptured, they're crushed. So type of closed wounds, again, I told you before, what do we have? Bruises, right? Or again, another term would be a contusion. Aside from that, what else is there? Hematomas. Okay, aside from that, what else do we have? Again, there could be crush injuries. All right, so bruises, contusions, hematomas, and crush injuries. So what do you do for these type of injuries? Again, you want to apply an ice pack there. Now forward to the injured limbs. To the injured limbs, you can apply an elastic bandage for compression. You can splint the limbs also. Okay, what else could you do? We said compression. Right? You can apply an elastic bandage over here. Elastic bandage is going to end up giving you compression. Also, you want to check for fractures. Make sure there isn't any broken bones. And again, you want to elevate above the level of the heart. Okay? That limb, you want to elevate it above the level of the heart. So wounds that require medical care. So we're talking about the long or deep wounds that need stitches. We're talking about wounds that may occur over a joint. It could be a bite from a dog, a cat, any type of animal. It could be, a domesticated animal, or it could be a wild animal for that matter. Or it could also be a human bite, and we're talking about why. If any type of injury, if it impairs function of your eyes, your eyelids, or even your lips, you need medical care. If you have an injury where the top two layers of your skin, or all layers of your skin, are removed, you need medical care. Again, this is your first line of defense. So if that's gone, you need to go and get treated professionally. If that wound is caused by some type of a metal object, or again, it's a puncture wound, you need to be treated by a medical professional, a healthcare professional. Again, anytime there's any type of, if there's a fracture, you need to get treated. Other times are when you have a gaping wound, or again, a jagged wound. Again, what are we talking about? We're talking about lacerations over here, right? Or if it's a deep wound. So, in addition to that, if there's any bones that are involved, a fracture, you're not able to move a limb or a joint, you need to get advanced medical care. If there is an embedded wound, we spoke about that, you need advanced medical care. If any of these wounds start showing signs of infection, which we went over, that would require medical care as well. So again, you're not able to move, or again, you're not able to feel a certain part of your body, or you have too much pain, the pain level starts to go up, or it's too intense, you need professional care. So you want to call 112 immediately if the bleeding doesn't slow down within 15 minutes. Now what are we saying? if it doesn't slow down. We're not saying stop, but we're saying if in 15 minutes it's not slowing down, you need to go to the doctor. Now, usually if you apply direct pressure, after 10 minutes it should stop. If not, then they need to go to an emergency room. If the patient shows signs of shock, they need to go to an emergency room. If there's a cut, any type of cut to the neck or chest, and it's causing difficulty breathing, they need to go to an emergency room. If they have a deep cut to their abdomen, and again, it's any pain, if they have any type of painful injury to their abdomen, they're complaining of pain from an injury to the abdomen, they need to go to an emergency room. If they have injury to the eye, their eyeballs cut, their eyes bleeding, they need to see an eye doctor, an ophthalmologist at that point. Or again, anytime there's a part of the body that's been cut off or partially cut off, they need surgery, so they need to go to an emergency room, they need to go to a trauma center. So as far as sutures go, now remember what we said, 6 to 8 hours, this is the window this is the optimal time to get stitches. And again, the benefits for having stitches is, actually there's a couple of things. First of all, you're going to heal faster, so you have faster healing when you end up having stitches. Aside from that, there's going to be, you're going to have less scar tissue. Hopefully you'll have less scar tissue when you end up having stitches. So a wound does not require stitches. We don't need sutures. When the edges of the skin, they come together. If the edges of the skin, they match up and they're not very far apart, through secondary healing, your body is going to repair itself. So again, so if you have a shallow, hold on, let's do it over here. So if you have a shallow cut, most likely you're not going to need it. And if the margins are nearby, the margins meet, margins are close, you're not going to need stitches. You probably don't need them. But again, let the physician decide if somebody needs stitches or not. Now, gunshot wounds. Now, at the scene of an active shooter, run, hide. If you need to fight for your safety, fight for your safety. Because again, a bullet doesn't have one name on it. A bullet has many names on it. It doesn't discriminate against anybody. One bullet can pass through one person and enter somebody else. So take cover and protect yourself if there's an active shooting that's occurring. So bullets, they end up causing injury by lacerations. Okay. In addition to that, they cause crushing injuries also. Okay. Bullets these are high impact injuries. When a bullet comes through you and hits you, it's a shock wave that's occurring. Okay, so you have temporary cavitation also that results. So if you look over here, in a gunshot wound, you end up having. So first of all, what do we have? Penetrating wounds and perforating wounds. So if a wound comes in only, right, this is a penetrating wound. Okay, so this is an entry only. Now for a perforating wound, you have both entry and exit points. Right? In this case would be, for example, if this is an entry, then perhaps that's the exit. It's coming out from here. So it goes in one side and comes out the other. All right? Or perhaps this one, it goes in, but then, the other side is okay. The bullet kind of moves somewhere over here, or maybe the bullet moves inside. This, believe it or not, is better than the bullet traveling somewhere else. Because again, if the bullet doesn't come out, then it's causing damage, further tissue damage somewhere else inside. And that's worse. So this is much better. In some cases, this ends up being better when you have an open and exit than, just a penetrating entry. When you only have an entry wound. So what do you do with gunshot when you have a gunshot wound. So first of all, again, ABCs. Don't forget ABCs: airway, breathing, and circulation. Monitor that person's breathing. All right. Expose the wounds. Control the bleeding with direct pressure. Okay. So expose the wound. Monitor the breathing. Direct pressure on the bleeding. Control it. Put on some dry, sterile dressing and a bandage. Hopefully, if you don't have sterile, hopefully you have that. If not, then make sure it's a clean dressing. And then put pressure on it with a bandage. You want to treat that person your patient for shock, keep them calm, and they need immediate medical care. Okay, you have to call 112, and they need to be transported immediately to a trauma center. Keep accurate records of what you see. Okay, keep accurate records of your observations. Preserve evidence. So if you find, gun shells or gun casings, keep that. That's evidence the police may need. Try not to touch it with your own hands. Again, this is another reason why it's important for you to wear gloves. Unless it's necessary, don't touch anything. Remember, you are at a crime scene, and you may be at an active crime scene. So don't touch, do not move anything. The detectives, they need to come and they need to recreate the events that took place and make sense of what happened there, and then write up a report on it, which will then go to the courts. All gunshot wounds, they have to be reported to the police. There is no exception, regardless of which country you're in. These have to, it has to take place. Okay? So that's it for this topic. Thank you.